Now by Dr. Okechika Olozi. He is the Chief Medical Officer at Del Sol Medical Center and a Texas Medical Center COVID Task Force member. Thank you for all you do and welcome.
Thank you.
Well, as we watch about 32 states across this country show spikes in COVID-19 cases, we also see hospitalizations grow in 23 states, and Texas admissions are soaring to a new record. More than 8,000 Texans hospitalized with COVID-19 on Sunday, among the highest in the U.S., and now the military is deploying medical personnel in response to help. What is going on in Texas, and what are your main concerns right now?
First of all, thank you for having me. But focusing specifically in on Texas, I think what we're really seeing is something that we did not expect. In as much as people have talked about waves, I think a better analogy is really a fire. It's like you go to a campfire, you don't put it out, you have a smoldering fire, and then tinder flows off into the forest. We're seeing multiple fires blaze not only in Texas, Florida, Arizona. South Carolina is not looking well either, and it's really concerning. We're hoping that we can get a handle of this, but it's yet to be determined.
Yeah, that is an incredible analogy there. And of course, as you mentioned, California, Georgia, Arizona, Nevada and others are also seeing growing COVID-19 hospitalizations. And when you see the images of Americans partying at bars, pools, beaches and water parks over the July 4th holiday, how worried are you that we will see even more spikes in cases and increased hospitalizations in about 3 weeks from now because of that lag time?
I think that's a perfect analogy, right? As we look at the behavior and the human spread, it's concerning. I mean, the fact that people are still engaging in a way that almost lays claim that this pandemic is not real is very concerning. I think one thing that people really have to understand, and we probably in the healthcare space have potentially done some messaging errors from the beginning, but we have to understand, if we want to get this under control, we have to focus on masking. We have to focus on hand hygiene, try to social distance or physically distance as much as possible. I think it's just as important for people to understand, if you're sick, isolate yourself from family members, potentially work, and get tested where you can.
Yeah, and I wanted to talk about that because New York appears to offer a unique model for the country. It started out as the worst affected state, but now all its coronavirus numbers have declined, even since reopening. And Governor Cuomo puts that down to the fact that he mandated the wearing of masks and kept restaurants closed to patrons for any indoor dining. Is that the key here, mandating masks and closing indoor dining along with bars?
I think that some of the political capital around that is questionable as we'll be able to move forward with that. I think what I really do focus on, and I think this is really important for the audience to understand, is that we each individually have a responsibility, not just to ourselves and our families, but the community. If we each individually take that responsibility on, we can change how we move. We can change wearing a mask. We can change the spread. People always say, Rosemary, that it's the economy stupid, but the reality is that it's the virus stupid. We're in virus time. And until we understand that this virus isn't going to go away, until we take the measures to slow it down, nothing else will matter. The economy, healthcare, a host of other things. And so that's really the message that we're trying to get to people, that we are where we are now, and let's try and move forward and ensure that we're able to get out of this peacefully.
Right, and Doctor, most medical experts say the US is in free fall with this pandemic currently, but the White House claims the world is looking at the US as a global leader in the fight against COVID-19. So, Doctor, with the highest death toll in the world currently standing at more than 130,000, how can they be thinking such a thing?
I think if we look back, and there'll be more than enough time for postmortems, we can attribute blame to a host of factors and a host of players in this narrative. One of the things is that, as tragic as all these loss of lives have been, I think that as people are slowing down their movement, and that's evidenced by credit card data that we're seeing, the open table data, people are changing their behavior irrespective of the politics, right? And so the longer we give science time to kick in, whether it's remdesivir that we have, whether it's dexamethasone, whether it's some of the broadly neutralizing antibodies and a host of other therapeutics that are coming down the line, people need to understand that our behaviors today don't play out for another 4 weeks. And so it's critical that we really take the responsibility to change our movement now.
Dr. Ogachika Alozie, thank you for joining us. And again, thank you for all you do. Appreciate it.
Thank you so much, Rosemary.